Now we try to look at the next modality that actually helps us in imaging. So I'm looking at the intravenous urography. And anytime you hear anytime you hear them saying anything uro, it just has to do with the urinary system. Okay, so anything uro is urinary system. So intravenous urography is just so you know, it's also known as what? Intravenous pyelography. So it's just a radiological procedure, and they usually use it to visualize the urinary system. So most of the time, I'm putting a contrast dye into the veins so to circulate, and there's a way to actually accumulate more in the kidneys, because the kidneys are what will actually filter out those dyes. So I'm not doing imaging, so because of the dye, it will actually enhance the picture of the urinary system that I'm supposed to get. So contrast dye, we say that is a radio opaque contrast, and usually injected into the vein. So circulation, the contrast is filtered by the kidneys that will be excreted in urine. So imaging, how about the sequential X-rays? They're now taken at different times, so you actually time it, and at different time you are having different concentrations of the contrast in the urinary tract. So from there you can be able to visualize the urinary system, the pelvis, the calyces, the ureters, the bladder, the rest of it. Okay. So why will you actually want to image the urinary system? So first of all, maybe there's like obstructions like stones, strictures, maybe the patient just all of a sudden is passing blood in urine, so you want to investigate. Assessment of congenital anomalies, dictation of tumors or masses in the kidneys or bladder, or sometimes before the operation, so you want to actually just observe it. So advantages, it will give you a lot of information and to help you to dictate anything that is abnormal within a urinary tract of a human being.